Jane. So tonight we have Jane Santangelo is back with us again, and we're going to be talking about harnessing nature's remedies for chronic disease management. And we're going to talk a little bit about mold and mycotoxins. And I've actually been doing a paper of this on myself for my group and the class, my private classes that I do. So I have a little bit of information on here too, but we're going to let Jane run with it and introduce yourself. And thank you all for being here, and go for it.
All right. Thanks, Doc. I really appreciate it. I'm very happy to be here tonight and happy to share. So I hope you find some value in this presentation. So there's your CME credits. I will also make this PowerPoint available to you if you would like it. Here's my contact information so you can reach me here. This is my email. This is my phone number. You can simply text or email me. So a little bit about myself for those of you who don't know me. 4 decades of experience as a managing partner of Integrative Wellness Associates. We were located in East Hanover, New Jersey. I worked with my husband, Rick. And I've been really just a driving force in promoting holistic health. I'm very interested in the topic, the subject. And as a wellness warrior over the last 13 years, I've organized, I've trained, I've attended many product symposiums and wellness seminars hosted by forward-thinking wellness professionals. My main focus today is consulting with health practitioners to add, first and foremost, educational value for the patient in terms of clinical outcome and keeping in mind revenue for the practice. So that's what I do for a living. So we cannot really start a dialogue about health and wellness without discussing what precludes that. So how we are injuring our immune response. I mean, for the most part, I think many of us, and we get caught up, and I was party to this as well. You know, we're working 5, 6 days a week, 12-hour days. We neglect ourselves. There's no time to cook. There's no time to think about eating healthy. But it's at a point where I feel as if what we do earlier is going to affect really what we do later. So many of us through all of that have neglected our health. We don't manage our stress. People drink too much to manage their stress. We eat horribly processed foods and we don't know how to read labels. Our sleep is not good, nutrient deficiencies and lack of physical education. And some people start isolating themselves over that. There's a little article that came from Carver.com. It's an organization that connects people in science, and they talk about physical inactivity accumulated over weeks, months, and years is associated with increased systemic inflammation, impaired natural killer cell activity, reduced T cell proliferation, all of which can result in a loss of viral control. Nutrient deficiencies. This is another one that we have to talk about so we understand possible reasons why people are prone to being sick often. So nutrient deficiencies suppress the immune system. The immune response is compromised when nutrition is poor, predisposing individuals to infection. A poor nutritional state may be exacerbated by the immune response itself to an actual infection. So actually, many of the commonly accepted causes of disease, inflammation, gut health, genetics, are really manifestations of micronutrient deficiencies. If you ever listen to Gary, what is his last name? Not Gary Knoll. There's a gentleman that I listen to. He's a human biologist, and he talks about when the leaves of a tree are brown and you call an arborist, he's not going to look and dissect that tree or the leaves. What he's going to do is he's going to test the soil. So inflammation is exacerbated by micronutrient deficiencies. Antioxidants, as we all know, quell inflammation if present in adequate amounts. Deficiencies will cause inflammatory processes to run amok. Poor gut health, it's all over the place. Every single physician is talking about gut health. It contributes to micronutrient deficiency. The bacteria in our gut make B vitamins and facilitate absorption of nutrients. But if we have poor gut health, it will certainly cause micronutrient deficiencies. Low immunity is often caused by microdeficiencies. Several micronutrients are needed to regulate the complicated immune network, which protects us against pathogens and cancer. Environmental toxins, Mizell spoke about a couple of weeks ago. Our body's detoxification systems run on micronutrients. Not enough means we cannot detoxify. Toxins in our environment are unavoidable. We just need to arm our cellular detoxification pathways with the micronutrients that are needed to deal with toxins. Hormones, micronutrient deficiencies compromise hormone synthesis. If you have the micronutrients that you need, hormones are more likely to be balanced and functioning well. Genetics. Micronutrients regulate gene expression. Some genes may dictate that you need more or less of a micronutrient to perform the same cellular functions as someone with a different gene. But the ultimate effect of genetically linked micronutrient deficiencies can be overcome with targeted supplementation. All of the above contributors to disease are a reflection of the micronutrient deficiencies. You correct those micronutrient deficiencies via targeted supplementation, and health will surely improve. My favorite vitamin out of, I guess, all of them is vitamin D. So one report studied almost 19,000 subjects between 1988 and 1995, and individuals with lower vitamin D levels were much more likely to report a recent upper respiratory tract infection than those with sufficient levels.
Jane, before you continue, I got a message. Some people can't see the slides. Is that?
Oh, how could that be? Let's see, share.
I see them.
You see them, okay.
Okay.
Hang on, let's do this,
Right.
and I'm gonna just.
No, it's
I
good. I
think
don't
it's
know what's
good, it's
going
good.
on. It's
It's
perfect.
good. It's coming from the other side, from the people's side, not you.
Yeah.
Okay.
It's not
From
from
them,
your side.
okay.
You're good. Continue.
All right. Sorry
Okay.
to interrupt. Okay.
No, that's okay. That's
Carry
right.
on.
So the evaluation of vitamin D in viruses and long-standing viruses, recent studies confirm that clinical validation and a highlight of metformin. There's a little thing, I don't know if you know about it, there's a lawsuit recently filed on metformin stating that metformin contains unsafe quantities of MDMA. It's a carcinogen. Just wanted to point that out. But I put this study in there because many studies published on these, long protracted viruses indicate that 50 to 70 of virus survivors may experience severe post-virus symptoms for up to 6 months, which include a wide range of persistent health problems. So the search for effective drugs for the treatment and prevention of viruses is still underway. Numerous studies have shown potential for current therapies for prevention and treatment, including antivirals, but the only clarity so far is that there's no effective drug driving clinical management in the WHO Health Emergencies Program. And I thought that was very, very interesting. So several studies have observed that low vitamin D levels are found in a large percentage of people with viruses with acute respiratory failure. Furthermore, it's been investigated that low levels of vitamin D are associated with long protracted virus syndrome in survivors of viruses. Vitamin D deficiency is widespread throughout the world and especially in Europe. So therefore, the use of vitamin D supplements, and there's a vitamin D receptor on every single cell, you most likely know that, but to prevent the spread of viruses, it's a potential therapeutic strategy that's very, very easy to implement. Vitamin D works in more ways than one against viruses. Vitamin D interacting with its receptors triggers the regulation of several genes involved in the immune system, and also enhances the innate and adaptive immune response against respiratory infections. So the macrophages, it promotes these cathelicidins, which are specifically designed to actually kill the virus particles and remove the virus from the cells. Another thing that it does that I thought was very interesting is that it alleviates acute lung injury, vitamin D. It also prevents cytokine storm and the inflammatory processes that go on in viruses. So despite promising initial results, neither government agencies nor the World Health Organization has recommended incorporating vitamin D into virus prevention or treatment guidelines. So this is just another study. And again, you can have access to this PowerPoint if you would like. Just please let me know. And I kept this in here because I wanted to highlight a couple of these points there. It's important to emphasize that vitamin D deficiency is related to many other diseases and conditions that will increase the risk of developing long-term viruses. And according to a recent review, this virus may provoke I thought this was very interesting, new onset of type 2 diabetes. That's wild. That I hadn't heard before. So the reviews aim to provide state-of-the-art vitamin D's role in the long-term effects of long viruses and update all the literature on the topic. The authors will present the impact of vitamin D deficiency on these virus patients and those with long-lasting COVID. And here's the study right there. Let's talk about another ingredient called pycnogenol. This study was done at Zurich. They did a 12-week quadruple blind study, a single center randomized control trial, and they found that people that had post long-term virus condition with secondary outcomes, which included symptoms of fatigue, cognitive function, health-related quality of life, functional exercise capacity, and blood biomarkers of inflammation, as well as endothelial function and oxidative stress. So for those of you who don't know, pine bark it's a licensed tree bark. Pycnogenol is derived from that and primarily used for the treatment of venous disorders. So, but it may have potential to improve the health status of people that are suffering from post-long virus conditions. There's a great book out there, simple to read, called Live Better Longer. This was done by Dr. Richard Passwater, PhD and scientist. He compiled a lot of information on pycnogenol. Pycnogenol is a pro-anthocyanidin and procyanidins. So it's particularly high in those ingredients. And some of the chapters in this book are protecting the heart and circulation, reducing the risk of cancer, slowing the aging process, skin health, venous health, eye health, ADD, allergies, and osteoarthritis. So all of those are in that small little book. Another interesting thing about pycnogenol is that it has the ability, and we all know about vitamin C. Vitamin C was, one of the first antioxidants that I think I remember learning about. But pycnogenol actually has the ability to take vitamin C that's used up and recycle it, and does the same thing for vitamin vitamin E. So I thought that was pretty interesting. Another ingredient that's great for the management of long protracted viruses is black cumin seed. So patients experiencing long-term viruses may use black seeds as an adjunct therapy in combination with symptomatic treatment, supportive care to prevent further deterioration and hospitalization. Also, they can combine the black cumin seed with thymoquinone. So that is also because they both have an antiviral, anti-inflammatory, and an immunomodulatory properties, as well as bronchodilation effects. So, that's on many viruses, they hit the lung area. And then I just put this in here too, that just shows that they're looking at both of those things. They each do something a little bit different. They have a broad, different extracts of the black cumin as well as the thymoquinone have broad antimicrobial spectrum. So I thought that was important to know. Let's talk about chronic diseases, things like heart disease, cancer, chronic lung disease, stroke, Alzheimer's, diabetes, chronic kidney disease. These are the diseases, I mean, I think they're of our age, but most importantly, as a patient myself, when I go to a physician, I really would always hope that I would get information from that physician that's going to help me fend off heart disease in the future, cancer. Like, what can I do to keep myself healthy as I get older? You know, there's nothing great about getting older and not being well. So empowering patients through education, offering useful tools to better their understanding of common chronic illnesses that are caused by especially lifestyle and nutrigenomics. Some of the tools that can be used, and I don't know, you may know these tools. There's an app called the Yucca app. You just go to your phone, your app store, and download Yucca app, and you can scan the foods that you're eating. And you'll see here they're going to give a score. So here they have, there's these little fish, little cheesy fish, and they gave that a score of 7. They're going to talk about additives. They're going to talk about sodium. They're going to talk about fat. And so I think it's very, very useful. It's a great place to start because this information, getting it out to the public that's just embarking on this journey, it could be overwhelming. There are people that are out there doing the work for us. Bobby Parrish is a young guy. I think he's in his late 30s, early 40s. He's got a young family, a little girl, and he does a lot of YouTube videos, and he does the work. So he's gone to all the stores and figured out what's the best olive oil. Where should you go for olive oil? What do you need to look for on the label? What are the best potato chips? What's the best Greek yogurt? So a person doesn't have to take all of that time trying to figure out, well, what is the best yogurt? Is this a good yogurt or not a good yogurt? Learn to read labels. He helps you with that and understanding ingredients. So those are the things that I like to talk to people about, to just give them tools to empower themselves. A couple of books that I have read that I absolutely love. I don't know if you're familiar with Dr. Jack Cruz. He is a neurosurgeon and he wrote the Ex-Paleo RX. I really could not put this book down. He ties, he's really a brilliant guy. He talks about early morning sun, late evening sun. He has a leptin tie-in to high cholesterol, dopamine. It cascades into every other hormone, and he actually ties it in, I believe, to osteoporosis because he's a neurosurgeon, so he does a lot of operations on backs. You'll hear his story and his forward. And I think one of the things that really got me to understand the foods that we're eating, and he sums it up here. Today's simplified foods create an overly simplified gut flora. Overly simplified gut flora leads to the production of more short-chain fatty acids instead of naturally selecting the stool-forming gut bacteria. This is why we've seen a huge spike in colon cancer in the US since 1900. That's what he says. Normal colon bacteria turn short-chain fatty acids into anti-inflammatory omega-3 fats. If you don't have those beneficial bacteria in your colon because your diet is so processed, you're now omegas to omega-6 to omega-3 ratio rises, creating a cellular terrain for cancer. In 1900, colon cancer was 37th leading cause of death in the United States. Today, it's the 2nd leading cause of death in the United States. So I thought that was very, very telling. And he's got a very, very interesting story himself. Another person that I started listening to, she's a brilliant woman. She's investigated a lot of the studies on intermittent fasting. Her name is Mindy Peltz. She's a chiropractor. She's a best-selling author, keynote speaker. And to just highlight some of the things that she talks about when you fast. And she starts off explaining that the science of intermittent fasting, correctly done, along with a healthy diet, is step one. You cannot embark on intermittent fasting and then think your fast is over and you're going to go back to box cereal and drinking. And not that drinking is bad. Everybody has a glass of wine or a drink here or there. But what she's saying is that when you break your fast, it's very important what you eat. And these are the things that she highlighted in the last thing that I listened to, and I thought they had enough merit to pass them on to you. So in a 13-hour fast, growth hormone goes up, fat starts to burn, testosterone goes up, and your CRP goes down. 17-hour fast, autophagy starts to occur and cells start to repair. Gut reset and stem cells come in that repair the lining of your gut in the 24-hour fast. Stubborn belly fat burns at the 36-hour mark. 48 hours, dopamine system reboots, and in 72 hours, your entire immune system reboots itself. I don't know about you, it just got me thinking of so many things in terms of fasting and creating health. I remember years ago reading an article, and it was anecdotal, of course, but the gentleman was in his mid-30s and he had gotten colon cancer, and he went on a 30-day cleanse of fasting. And at the end of the 30 days, he claims his cancer was gone. So what that means, I don't know. It's for, it's for the authority, for the experts to interpret. But when you see something like this, that the science is showing the entire immune system is actually rebooting itself, it's something for everyone to really look into. So lifestyle and nutrigenomics, the latest scientific research in nutritional epigenetics reveals that adopting a healthy habits can turn off harmful genes. I remember thinking, well, if you're stuck with genes, you're stuck with genes, but that's not really the case. The good news is that bad genetic changes are reversible. It's possible to take steps to improve healthy outcomes by adding healthy habits to our lifestyle. We can turn on those genes or turn off those genes. But the typical diet in the United States is high glycemic, suggesting that many chronic diseases in the United States may be mitigated by dietary changes. So low glycemic lifestyle is now touted as a longevity diet. And of course, everybody's got their sights on the blue zones. It's getting a lot of press. And this was written in this article down here. So if you want to check that out, see the full article. So now we come to our last segment, which is natural remedies for mold toxicity and relief. So mold toxicity can be a silent intruder, wreaking havoc on our health without us even realizing it. The unpleasant truth is that mold toxins, also known as mycotoxins, can accumulate in our bodies and lead to a range of troubling symptoms. If you have a compromised immune system or pre-existing respiratory condition, you may have a higher chance of experiencing a mold-related health condition. According to a 2021 study, having a diagnosed sensitivity to mold is associated with much more severe symptoms of eczema. Eczema involves dysfunction, of course, we know, of the skin barrier, which could leave the skin much more sensitive and react to potential allergens like mold. So what are some of the natural remedies for mold toxicity? Activated charcoal, that's a great one. Activated charcoal, finely powdered substance, plays a vital role in managing mold toxicity. I didn't know that. I knew it was a detoxer, but I didn't know specifically for mold. This is a natural remedy. It acts as a magnet in your digestive system. It absorbs mycotoxins, therefore it prevents their entry into the bloodstream. And by doing so, it contributes to reducing mold toxicity symptoms and promotes better digestive health. Bentonite clay is often referred to as a healing clay. It's another natural remedy for mold toxicity treatment. This clay is highly absorbent and can trap mycotoxins in your digestive tract. It'll meticulously clean up harmful toxins, and beyond mycotoxin removal, it provides soothing relief from gastrointestinal discomfort. Chlorella is a green algae that has an abundance of chlorophyll. It's great for detoxification. This natural compound helps your body eliminate toxins, including mycotoxins, by enhancing your detoxification process. Chlorella's immune-boosting properties further strengthen the body's ability to combat the effects of mold toxicity and facilitate a quick recovery. Saunas and sweating. Sweating is a natural detox method, and saunas are here to amplify that process by inducing sweat. Saunas facilitate the expulsion of mycotoxins from your body, and this offers relief from mold-related symptoms like fatigue and headaches. So spending some time in saunas from time to time will certainly help prevent mold toxicity. We have ginger and turmeric. These are great. You can make some great drinks out of these. These are spices. They're renowned for their potential anti-inflammatory properties. They're a great option if you're looking for natural remedies for your mold toxicity treatment. Ginger and turmeric are your allies in reducing inflammation, especially concerning joint pain and headaches. So whether you savor them in your meals, opt for supplements that they offer comforting relief and support in your journey toward recovery. Our old standby vitamin C, this powerful antioxidant, does so much from, creates better skin health, and antioxidant. It's great for your immune system, aids in detoxification. C neutralizes mycotoxins and diminishes their adverse effect on the body. It's a functional nutrient that not only supports recovery, but contributes to our overall health. And quercetin, it's found in many foods like apples and onions and citrus fruits. It's celebrated for its anti-inflammatory and antihistamine properties. It is your trusted companion in alleviating mold-related allergies such as sneezing and itching. It's great for mold toxicity. As a treatment, it reduces your body's sensitivity to those mold spores. Here's some plants that you can put in your home. Plants like snake plants and spider plants offer a natural way to purify your indoor air by diligently absorbing mold spores and other impurities from the air. These green companions contribute to your overall well-being by reducing your exposure to mycotoxins and ensuring you breathe cleaner and healthier air. Meeting Point Health is a facility that you can call. They are one of the experts on mold. Their number is right here, and you can contact Dr. Stephen Matta there. He'll give you anything that you need to know about mold that you don't already know, if you've got a tough case there. So thank you. It's been my pleasure. I hope you found value in what I presented. This is my contact information again. So you just certainly feel free to reach out and ask me any questions that you would like. If I don't know the answer, I will surely get an answer to you. I will research whatever your questions are and give you a thorough answer.
Wow. Okay. That was a lot to take in all at once. So,
well, that was the list. That was the list I got.
okay, that was quite the overview. There. The folks in Florida who have have way more mold than we do out here in Nevada. Snakes and spider plants, is that something that you're familiar with?
That that's what they said. The snake plant, I just read an article before I actually found that information all about the snake plant, that it puts oxygen into the air. So this is good to have around your house.
This is a snake plant, this one.
There you go. That's it. Yep.
Yeah.
All right.
We have a couple.
Does it keep the mold away?
I don't know. I'll tell you what I had installed. I had this thing installed into my. It's called the Ream Halo. It's up there, and you put it in your AC duct, and it ozonates, or I think it's ozone and UV, so it kills all the mold that might be accumulating in there.
Where are you from, Stefan?
I'm here in Melbourne, Florida, right on the beach. It's pretty humid here.
Okay, yeah, there's a lot of mold out here. You have to really you have to be on top of it.
I sure am.
When you get a lot of water damage buildings from hurricanes and things, right?
Yep. Yeah, I got a roofing job. We're trying to repair a roof out here. It's got water damage. I had the whole AC ducts yanked out. $10,000 later, I had it all repaired. Had my shower repaired just recently. That was like $7,000. Does it have mold all through the grout? The grout's terrible. Don't get any grout.
It's a whole different world there from where we are.
Whole different world. If it can hold moisture, it's gonna grow mold. It's gotta go.
Okay, so
Exactly.
and anybody else having any questions? If
If it, yeah, I have just a state. Well, something I want to add here regarding Clotho. Even if you normalize the level of vitamin D and the Clotho is low, the vitamin D will not work effectively. So it's very important just to add another layer when you do vitamin D level, especially for all guys above 60. They need to also measure their Clotho. And if you normalize the vitamin D and their Clotho is low, that's mean why? Because Clotho is responsible to express the genes of the downstream signaling of vitamin D. And so you have to have this downstream signaling, which is receptor and all the way down to the genes. And anybody has deficiency of Clotho, even if you normalize the vitamin D is not working. So
Correct.
something to add another layer there, an extra 1 cent kind of statement.
how does one measure Clotho?
Well, that's what we have. Some labs are doing it. It's just a new thing, but there is some labs. We cannot mention it the names because
Yeah, well,
because of the CME thing. But I will I'll let you know.
okay, let me know. All right, so
Right.
Anna asked, can a patient with Hashimoto's or another autoimmune condition take, and she left out the end. So if you're on, Anna, could you finish that sentence for us? Okay, so thank you, Jane. So I knew this would be fairly quick, so I prepared a little more information on mold. If you're all interested in this, as you know, Andrew Campbell is our resident guru here. But if you're so willing, we're going to do a little bit more of a deeper dive into mold and mycotoxins. Is that okay?
Go for it.
Good to go? Okay. So again, since this is CME credits, what are mold and mycotoxins and how do they impact health? Jane's already given us an overview here. Effective and there's a difference between molds and mycotoxins. So we're going to sort of describe those. We'll talk about a couple of different tests for each. We'll talk about some neurological and endocrine impacts because that's where the body's affected most. Some special populations, and we'll get into some treatment issues. And I know Jane did a lot good on the natural remedies. So exactly what are we talking about? Molds are fungi that live on animal or plant matter. The fungi are eukaryotic organisms that lack chlorophyll and include mushrooms, yeasts, and molds. Molds are multicellular organisms that grow as filamentous structures called hyphae. The hyphae are thread-like cells that form a network called a mycelium. The mycelium is a vegetative part of the mold and it absorbs nutrients from its surroundings. So you see one piece feeds on the other. So the structures are hyphae, long thread-like tubular structures that make up the body of the mold. So that would be this here. Spores that are produced, the mold is reproduced through the spores, which is here, and they appear as small, round, or oval particles, and they're often attached to the hyphae. And the mycelium is the whole network. And it appears as sort of a dense vegetative sort of hive. And so the whole thing is called the mycelium. Usually they can range in colors from green to white to blue. Of course, black mold is the is the sort of classic, scary mold that you find when you peel the wallpaper back, or the linoleum on the floor. Divisions within the hyphae, septa, and nuclei are present, and there's cellular details, and there's environmental particles. So mold can grow on pretty much anything, on wood. It's in a lot of foods and in organic matter. There's different types of molds. These are commonly indoor molds. Penicillium, there's over 200 known species, and that's where penicillin came from. And it produces mycotoxins like ochratoxin. Aspergillus has different types of mold, and this produces aflatoxins, and so we get different results from different spores. And cladosporium is one of the more common outdoor molds, and it can grow in damp areas. And in this one, I'm not even going to try and Stachybotrys. I'm not even going to. This is your black mold. So growing conditions, you really need optimal temperature between 77 and 86 degrees, but sometimes it can grow as low as 32 degrees. Water damaged buildings is our and high humidity is two of our most frequent areas. And any humidity over 70 degrees constantly, as in Florida, you will get rapid growth, especially when we have water damaged buildings. Molds release spores that can remain dormant for years until their suitable growth for conditions arise, and spores germinate and hyphae grow to absorb nutrients, gradually forming those fruiting bodies, the mycelium. And there's lots of different species. There's thousands of them worldwide, and they're always there's always new ones coming on board. So mycotoxins, this is the toxic part, the metabolite that's produced by certain mold species. All mycotoxins are fungal, so the antifungal agents will have some effect on them. Not all fungi produce mycotoxins. Different strains of mold, I already mentioned a few of those. So Aspergillus will make aflatoxin, Fusarium will make trichothines, and Penicillium makes the orexatoxin. Warm, wet, humid conditions, carbohydrate-rich environments, so carbohydrate-rich foods, cereals, nuts, spices, apples, coffee beans, and in patient environments, high blood sugar, diabetes, high carbohydrate diets, excessive or repeated antibiotic administration. Mold usually is visible, has a musty odor, and symptoms can be nasal stuffiness, eye irritation, wheezing, allergic reactions, fevers, and shortness of breath. Mycotoxins are not living. These are toxic chemical compounds produced from mold. So mold is living, mycotoxins are not. Mycotoxins are invisible to the eye. There's no noticeable odor or taste. You need laboratory analysis to confirm this. We get immune deficiencies, neurological impairments, chronic diseases, and cancers. I just mentioned a few of them here. Aspergillus, which gives us the aflatoxin, gives us liver carcinomas, the trichothines, renal damage, and ochratoxins, esophageal cancers are common. Mold exposure, symptoms, again, we mentioned nasal stuffiness, congestion, sneezing, sinus pressure, so allergies, sore throats, wheezing, nothing specific. Chronic diseases, you can get fatigue, headache, nausea, vomiting, diarrhea, memory issues, and mood changes and irritability. Mycotoxin symptoms are pretty much the same. Again, nausea, vomiting, abdominal pain, diarrhea, fevers. I had a patient in. She said she went to work in an army depot, and she walked in, and she said it smelled funny, and within 2 hours she had a headache, and within 6 hours she was in an ER with sort of an acute it looked like an acute viral syndrome. She stayed home for 2 days. She got better, went back to work, and the same thing happened all over again. Chronic symptoms, we get immune issues, Neurological issues, especially headaches, memory loss, irritability, liver and kidney damage, skin irritation and dermatitis, reproductive issues, GI distress, cancers, developmental growth issues, and endocrine disruptions. So get rid of that. And these are different types of mycotoxins. I'm not going to just read the list here, but again, ochratoxin, T2 toxin, cladosporium are the most common ones. Penicillium is another one, and the last one, number 12, Stachybotrys, that's trichothenes, that's your black mold. As we just mentioned, so the black mold can cause neurotoxicity, chronic immune issues, and fatigue, headache, and nosebleeds. Verrucarian, caused by Fusarium and Aspergillus, can cause tremors, immune toxicity, inflammation. Ochratoxin, which is one of the more common ones, immune suppression, asthma, COPD, urinary tract tumors. This alters the DNA and protein synthesis and can lead to the leaky gut syndrome. It's not excreted in the urine, so you're not going to find ochratoxins on a urine test. It potentiates interleukins-1 on interleukins-8 secretions, and you get an increase in interleukin-1 and interleukin-8 of 35 to 138%. It augments transepithelial passage of commensal bacteria, and at highest levels of ochratoxins are found, unfortunately, in breast milk. T2 toxin is used in biological warfare, and we get GI and reproductive issues, and it can cause low testosterone. Vomit toxin is intestinal barrier issues, can cause irritable bowel syndrome, celiac disease, and can alter hormone levels. Cladosporin toxin, airborne spores are allergic, respiratory diseases. Ternera toxin, this is cytotoxic, emetogenic, mutagenic, and genotoxic, and causes immune suppression rather. Aspergillus can cause immunosuppressive, carcinogenic issues, and also hepatic issues. So as you can see, there's a wide range of issues with all the different types of mycotoxins. So mold testing. So this is, you can go to a local department or hardware store and get an airborne mold test. You can do air sampling. Can detect mold in indoor air. Pumps and filters can trap airborne mold spores on nutrient substrates. That they can be analyzed. There are professionals that do this, and they can do mold counts for you, and they can identify the spores, hyphae, and fragments. The results are reported as spores per cubic meter. And this is a typical detailed mold report. There's different air analysis, and so it'll give you a date, the location, the sample identification, and it should be able to identify the different fungi that are affected. So you can do swab testing. You can swab different areas over about 4 to 10 inches, and it compresses the spores and fragments for laboratory analysis. They can be cultured on agar plates and examined microscopically, and you can get specific extracts of which mold you're dealing with. The air and swab molds yields the most comprehensive information on indoor mold contamination. And in Europe, this reference that I have, 3 to 10% of the total population is affected by some sort of mold. So these are different types of plates, and what you'll see on them. These are just some examples. Mycotoxin testing. So this is rather controversial. Our favorite mold expert, Dr. Andrew Campbell, does not like urine testing, but it is quite extensive. Note that there's no FDA-approved test for mycotoxins for human urine, but it is non-invasive. It can detect, detects the metabolites and byproducts after exposure. It measures free mycotoxins in urinary metabolites. But remember, ochratoxin, which is one of the more common ones, is not excreted in the urine, so you're not gonna find that in a urine test. The mycotoxins are rapidly eliminated from the body, and urine tests are for more recent exposures, so within 1 to 3 days. They are again, like I said, no FDA approved test for mycotoxins in human urine, and Dr. Campbell is decidedly against this means of testing. I bring it here just because it is quite common. And when their urine levels of are shown of mycotoxin, it does not mean there's pathology. This is a urine testing sample, and what we're looking for here is anything in the red, especially when it's at the max here. So this unfortunate individual has an ochratoxin, roridin, was a trichothene, and verrucine, and but this one here is another common one. It's not present. So serum testing, this is Dr. Campbell's go-to. This allows detection of mycotoxin proteins or DNA adducts in the blood from exposure. This is longer-term exposure, at least several weeks to months. So someone who's been exposed to mycotoxins, you really need the blood tests. The urine tests are more for short-term exposure. And this is seems to be preferable to evaluate chronic and repeated exposure. The biomarkers are more stable than in the urine, and when it's positive, it's generally considered evident of mycotoxin exposure. It's more accurate than the urine, and the tests that we look for 12 distinct IgG and IgE antibodies, and I'll explain the difference between them. This is an example of a serum test for IgG, and this is for these are different mycotoxins, and this is highly positive, and this is all 12 of them, and as you can see, all but 2 are in the red zone. So these are highly positive. IgE is more of an allergic type, delayed allergy type reaction. It's more along the lines of mast cell activation. And although there's only one here, we would probably want to address this, but we address this quite a bit differently than what we do with the mold or the mycotoxins that are in the IgG realm. So the IgG is, again, long-term defense against pathogens. Positive antibodies indicate ongoing or past exposure to mycotoxins, and the significance of an elevated IgG level this is a chronic immune response. IgE mycotoxins is a hypersensitivity response, and think of it again as an allergic response. And we seem to do well with DAO inhibitors rather than traditional antihistamines or even the non-sedating allergy medications. Elevated IgE indicates acute exposure, signaling an immediate allergic reaction. It reflects, again, like I said, mast cell activation, and it triggers the release of pro-inflammatory cytokines. So the brain is the most sensitive organ that is affected by mold and mycotoxin infestation. Mycotoxins interfere with mitochondrial function and create cellular apoptosis or cellular death. The mycotoxins break down the blood-brain barrier and can cause various types of nervous system diseases, chronic inflammatory diseases, and then chronic neurodegenerative diseases, including dementias, Parkinson's disease, and ALS. Also, in youngsters, neurodevelopmental issues can occur, including learning disabilities, ADHD, and autism. Cerebral effects of mycotoxin infestation include reduced executive function. And so I'm going to switch hats here for just a second and talk about executive function. Executive function is the ability to get things done. It deals with memory, concentration, the ability to start projects, the ability to finish projects, the ability to multitask easily or not. It involves obsessive compulsive tendencies, dark moods, paranoias. These are the traits of growth hormone deficiency. And so what we see with mycotoxin, cerebral mycotoxin infestation is a reduction in growth hormone in children and adults. And in the children, if it's allowed to fester, you can have stunted growth and stunted neurodevelopmental involvement. You get reduced judgment and intellect, reduced hand-eye coordination, reduced memory and attention, and it's been termed an inhalation Alzheimer's disease. So because again, this is airborne. These are airborne particles, and we end up with an asthmatic type situation due to the mycotoxin infestation. But I highlight this when, remember our talks on traumatic brain injury, and the key to recognizing that it was hormonal deficiencies and not just garden variety depression or anxiety was, again, reduced executive function. So get to know what executive function is, because it's going to come up again and again and again. Hormones, again, we talked about growth hormone. So we see an increase in estrogens, particularly with zeranolone, an upregulation of aromatase. And it also blocks cytochrome P450 enzyme, which helps retain estrogen, and you can get early menarche in young girls as young as 6 years old from increased estrogen levels, and we end up with estrogen excess symptoms. Estrogen excess symptoms are, for the most part, estrogen forms cysts and in the affected organs. So breast cysts, breast tenderness, fibrocystic breast disease, uterine fibroids is uterine cysts, ovarian cysts. On the endometrium, we call it endometriosis. And we can get spotting in between periods, and also associated with this are gallstones. So typically a patient will come in and they'll tell me that, well, they had their gallbladder out when they were 30. They're now 40. They're spotting between periods. They're gaining weight in the middle. Their mother didn't have had a normal menopausal time, but they have breast cysts and fibrocystic breast disease. Again, mold is part of this. With that, you get a decrease in testosterone. So mycotoxins involved are T2, aflatoxin, orexotoxin, and I can't even pronounce this one, deoxynivalenol. You get a Leydig cell disruption. You get a decrease in LH and a Leydig cell disruption, a poor libido, erectile dysfunction, and infertility. And with this, and also with the estrogen, you get an increase in cortisol, which yields a decrease in testosterone. If you'll recall from our other lectures, one of the antidotes for high cholesterol, goes 1-for-1 is DHEA, which is one of the precursors of testosterone. And so for women, 10 to 25 milligrams of DHEA will help alleviate high cortisol levels. And for men, anywhere from 25 to 100 milligrams of DHEA. We'll also get a decrease in thyroid function. We'll get a decrease in the conversion of T4 to T3. We'll get an induction of oxidative stress, so that we can look at some of our antioxidant and anti-inflammatory nutrients. We'll talk about them in a minute. And we get an interference again with TSH. Progesterone will become increased with alterenol and decreased with several others, including that T2 toxin. Again, we get an interference with that LH transmembrane and interference with FSH. And if you'll remember our discussion on testosterone, especially in young men, One of our remedies that we've been looking at lately, and I've been treating guys with that young guys who want to maintain fertility with some low dose progesterone to stimulate testosterone production. We get an increase in cortisol, as we mentioned before. It activates the HPA axis. So the mycotoxins can increase cortisol levels by 200 to 300% within 4 weeks. We get a suppression of the immune response, leads to persistent inflammatory cascades and reactive oxidative stress. So cortisol, the body reacts as an anti-inflammatory, which only goes so far until we get excess cortisol, and then we get all the symptoms of too much cortisol. And mycotoxins can directly injure the organs, particularly that orexotoxin, which does not show up in the urine, and it can damage the kidneys. Several disease states that have been associated with mycotoxins and molds, including autism, Alzheimer's disease, and so this paper here, and at the end of this, I have the references. 80% of Alzheimer's disease in this study have some sort of elevated mold and mycotoxin. So it might be if you're dealing with Alzheimer's patients, it might behoove you to check them for that, and possibly we can alleviate some of the mental deterioration, or at least slow it down. Autoimmune diseases, go hand in hand with all the other things we've talked about. So mycotoxins can exacerbate autoimmune conditions by producing inflammatory responses in patients with pre-existing immune compromise. And of course, chronic sinusitis. I mean, this is pretty classic. Patients will come to us, we're the integrative practitioners, and they've been to 3 doctors and 2 nurse practitioners, and even a couple of ENTs. They had an MRI. They've had 17 rounds, or not, that little exaggeration, but 6 rounds of antibiotics. And the antibiotics after 6 weeks will clear the sinusitis for 2 or 3 weeks, and then they're right back into it. If they're diabetic or have higher blood sugars, that's sort of a double whammy. We've been using antifungal nasal sprays. So anybody who tells me that they've been on 5 or 6 antibiotics, and these come back, I mean, I'll just go right to this. I like this combination here. We'll use the BEGI. We'll use the euphorin, EDTA, genomycin, iatroconazole, which is your antifungal agent. In a nasal spray, we can have it compounded. It's a 5 cc solution, and we do 1 spray each nostril twice a day for 28 days, and this works quite nicely. If there's a lot of inflammation, we'll even put some ivermectin in it also. Again, other chronic disease states, again, neurotoxicity and immune suppression can lead to ALS. Asthma, again, this is an airborne phenomena, and we can get environmental allergens. Mycotoxins can interfere with dendritic cell function, leading to decreased Th1 differentiation, and mycotoxins induce reactive oxidative stress in the lung. Demyelinating diseases, mycotoxins can cause myelin loss, leading to symptoms similar to multiple sclerosis and chronic inflammatory demyelinating polyneuropathies. Mast cell activation, we talked about that. That's your IgE antibodies. And spores navigate the airways, signaling toll-like receptor cells and mast cells. They activate mast cells to release histamine and proteases. You can measure tryptase. Usually, if you do a serum tryptase, you want to get it after a mast cell event. Pro-inflammatory cytokines and chemokines can be elevated. They can generate arachidonic acid products. Mast cells can be activated by fungi, provoke the release of cytokines, interleukins 1, NF-kappa beta, and you end up with those hypersensitivity reactions. And, they have respiratory tract, eye issues, recurrent sinusitis, bronchitis. Neurological manifestations can be fatigue, nausea, headaches, brain fog, and that's the IgE antibody. Therapies. Well, number one, most important, you need to remove the patient from the toxins and the toxins from the patients. So, if the patient's living in a mold infested home and they keep going back to that every day, you're banging your head against the wall. Nothing much is going to work. So we can go into some detail here. So diet, probiotics and prebiotics, some other nutrients. These are ones that we found useful. Phosphatidylserine for brain fog, infrared sauna, again, as Jane mentioned, for sweating out the mycotoxins, and we also like nitric oxide. And then to kill the fungi, we can use some systemic or intranasal antifungal agents. Talk about a couple of those. Prevention, moisture control is the key. So repair any leaks in pipes, roofs, and windows. Those of you who live in hurricane areas and the homes keep getting damaged, you just got to pick yourself up and start all over again. Try to keep the home's humidity below 50%. Improve air circulation with exhaust fans when cooking or washing. Open windows when the weather permits, and it helps reduce moisture and waterproof everything. Identifying the molds may help with certain conditions. And the classic household molds are the ones that you see here. Again, penicillium and aspergillus. Cleaning, minor mold cleaning you can do with soap and just a detergent. Bleach is usually pretty effective in non-porous surfaces, but be careful with toxic fumes. And then after that, you're going to need some professional help and some professional remediation. Dead mold can still cause some allergic reactions, and you need to remove it. It's not just enough just to kill it. So next, we're going to talk a little bit about the diet. And so, we're preaching to the choir here. You need a gluten-free diet. You got to stay away from wheat, barley, rye. You got to stay away from those carbohydrates. Remember, gliadin is the protein in gluten. That is a major stressor of the junctional walls of the small intestine. And remember, 80% of the immune system is also in the small intestine. When these junctional walls are loosened, it allows toxins, microbes, and food particles to enter. The body fights back by forming defenses or antibodies to its own tissue. And remember, gliadin closely resembles normal tissue, particularly a T3 or thyroid, triiodothyronine. It sets in motion a case of a mistaken identity or molecular misidentification, and incorporates the gliadin in the abnormal T3 hormone. The body misinterprets this normal tissue as an invader, leading to autoimmune responses. And you'll end up with the classic, Hashimoto's thyroiditis. Environmental antigen exposures in general leaves susceptible individuals to cross reactions and with similar amino acid motifs with their specific hosts. Here are the bad guys. Did I skip something? No. Here are the bad guys: white flour, white sugar, and dairy. They need to be fired. And we talk to patients about this. We have a program. We have an online program that we use that is we'll send patients daily for up to 3 months. Recipes, menus. It'll have shopping lists. It'll have weekly suggestions for weekly lists. It's quite extensive, and it's quite helpful, and it saves us a lot of time. But these are the bad guys: white flour, white sugar, and dairy. And and we tell the patients it's a Judge Judy deal. It's a yes or a no. Now, we know they're going to go to birthday parties. We know they're going to, on the weekend, they're going to go, to go out and drink. We tell them, as far as alcohol is concerned, the clearer the alcohol, the lower the sugar content, the better it is, for their, mold infestation. So the dark stuff. So beer is the worst. Beer is drinking a loaf of white bread. Red wines would come next. White wines would be next. And then anything clear is in the hard alcohols has the least amount of sugar in it. Not that I'm advocating drinking or alcohol, but patients are going to do that. These are behaviors associated with gluten sensitivity and things. There are behavioral issues, mood issues, including apathy, depressed mood, hyperactivity. Physical symptoms are either weight gain or lack of weight gain, cramping, diarrhea, itchy skin, eczema, loss of concentration, apathy, confusion, mood swings, depression, and reality perception disorders. Again, none of these are specific for anything, but we have to put it together with their environment and their diet habits. And again, for leaky gut, the 4 R's. So we remove the inflammatory agents, and we already talked about them: white flour, white sugar, dairy, gastric irritants, alcohol, caffeine, and certain illegal drugs, and even some legal drugs. And we need to treat the infections. We replace the essential nutrients with proper utilization of foodstuffs, digestive enzymes, hydrochloric acid, and bile salts. We restore the normal GI flora. We use prebiotics and probiotics. We like here we have mentioned the bacterial probiotics, but we like the spore-based probiotics. They're a lot hardier, and you need less of them, and they'll go a much longer way. We also like one called Saccharomyces boulardii, which is a sort of in a category all by itself, and that works quite nicely as a probiotic. Prebiotics are essentially the food that feeds the probiotics, and fermented foods, things like kimchi, sauerkraut, kombucha, and fermented vegetables are examples of foodstuff prebiotics. And then to repair the GI lining, L-glutamine seems to be the most potent of them, and you can get a combination of different things. Oily fishes, vitamins A, C, and E, aloe vera, slippery elm, and then you need to replace the digestive enzymes, and we like a little pinch of Himalayan pink salt. So here's more on the probiotics, and we just pretty much covered that. So I'm going to just skip over that. And the prebiotics also, here's the sort of the doses for them. Here's vegetables that also have prebiotic properties. So chicory, Jerusalem artichoke, green and root vegetables, psyllium husks. So we can get that or insoluble corn fiber. So you can get that, in a commercial product. Vitamin D, I know Jane talked a little bit about that, and when I was looking up, I get these videos on something called ViewMedi, which I guess is the YouTube for medical people, and there's one been circulating every 3 to 4 months by somebody from UCSF, the head of the endocrine department, where he basically says any vitamin D is other than for rickets is not necessary for anything. And this is the head of and I just got this just a couple of weeks ago again. So, out there, the academics don't like this at all, but we have, tons of literature showing that the importance of vitamin D for everything from liver dysfunction to skin integrity to bone strength, to cardiac function, and to immune function. So remember that vitamin D is crucial for calcium metabolism, and it's necessary for calcium absorption into the bones. Aflatoxins interfere with calcium utilization, so vitamin D is one of our sort of side go-tos for that. We titrate vitamin D. Most labs, the normal will be 30 to 100 nanograms per milliliter. We want it to be at least 50 to 80. And the way to replace it, for every 1,000 units of 25, it will increase vitamin D3. It will increase the 25-hydroxy vitamin D level by 8 points. So if you have somebody with a vitamin D3 level of 25-hydroxy vitamin D of 25, midpoint is 65 there on that 50 to 80. So if you get 5,000 units, 5 times 8 is 40, and 25, that'll get you right dead center. There are 25 and 50,000 weekly units, weekly time-released vitamin D. Some of them are prescriptions, some of them are over the counter. We have used them. It doesn't translate exactly to 7,000 if on a 50,000 per week, but they're pretty good, and we can use them. They're very inexpensive. They're maybe 60 or 70 cents a piece, so 60 to 70 cents a week. You can get them pharmaceutical grade, and once a week, so they're easy to use. The hardest challenge is make sure the patients take them. methylated B vitamins. So, B12 folic acid deficiencies are constant with mycotoxin toxicity. Remember, mycotoxin toxicity damages the intestinal lining, which is where your intrinsic factor resides. And without intrinsic factor, you will end up with B12 and folic acid deficiencies. We can replace it. If we don't, we end up with neurological manifestations, particularly peripheral edema, and also vertigo and balance issues. Magnesium aids detoxification pathways and reduces inflammation. Omega-3 fatty acids, that should be a 3, not a hashtag. So DHA seems to be more anti-inflammatory towards mycotoxins than EHA or even polyunsaturated fatty acids. DHA will protect the kidney. The anti-inflammatory actions of the omega-3 fatty acids will decrease toll-like receptor 4, NF-kappa beta, COX-2, MPO. It will decrease triglycerides. Foodstuffs, you want oily fishes, so salmon, mackerel, and sardines. Be careful with high mercury fishes, including tuna fish, swordfish, tilefish, and shark. Remember that omega-3 fatty acids have a blood thinning component to it, so be careful with those on antiplatelet therapy. And our dose is usually 2 to 4 grams of EHA, DHA, or a combination. And we want, even on the over-the-counter, we want a pharmaceutical grade. Coenzyme Q10 plus L-carnitine together protects against mycotoxin-induced oxygen toxicity, where you end up with excess free radical oxygens. And so it's an anti-inflammatory and an antioxidant. And this is particularly useful for fatigue, 200 milligrams per day. Zinc is an antifungal, especially zinc pyrethrin, sorry if I pronounced that right, inhibits fungal growth by increasing copper. Copper damages protein, damage to the protein iron sulfate clusters essential for fungal metabolism. So increasing copper is the key here. Zinc plus selenium alleviates ochratoxin nephrotoxicity. Zinc will preserve intestinal epithelium, and zinc can sometimes aid the accumulation of aflatoxin, so you need to be a little bit careful of that. Melatonin ameliorates oxidative stress, mitochondrial dysfunction, and inflammation. It protects against intracellular reactive oxidative stress, reduces mitochondrial membrane potentials. Protects against ATP degradation. It protects against the upregulation of TNF alpha, interleukin 6, interleukin 1 beta, and NF kappa beta. It protects against mitogen activated protein kinase phosphorylation, and it protects against mycotoxin binding to reactivate oxidative stress. Melatonin prevents DNA damage, accumulation, and cell proliferation and tumorigenesis by activating a P53 tumor suppressor pathway. And so melatonin is important with mycotoxin. N-acetylcysteine, one of our favorite go-tos. It's an antioxidant, anti-inflammatory. It's a liver detox agent. It regulates hormones. It enhances microorganism degradation. It breaks down mycotoxins. It enhances, of course, glutathione peroxidase and glutathione reductase. It activates NRF2 and regulates antioxidant detoxifying enzymes. It improves energy. You need 900 to 1,800, preferably the higher dose, 1,800 milligrams a day to get an adequate response. Remember, I mentioned that mycotoxins attack the brain first. Your go-to here is phosphatidylserine. You need at least 100 milligrams. I've seen it up to 500 milligrams. The mycotoxins can cause the loss of myelin. Neurological related symptoms are headaches, blurred vision, brain fog, numbness and tingling, short-term memory loss. Phosphatidylserine is a membrane of a component of the brain cell membranes. It comprises at least 60% of the brain cell membranes. It improves communication between brain cells. It increases nerve growth factor activity and reduces cortisol in response to acute physical stress. It combats fatigue. It prevents physiologic deterioration with overexercise. It improves memory, concentration, and cognitive function. Nitric oxide, we've had Dr. Brian on a couple of times speaking about nitric oxide. Nitric oxide modulates reactive oxidative stress and inflammation. It is a free radical scavenger, i.e. an antioxidant, and it directly neutralizes peroxynitrate, anions, and superoxide radical inducers of cellular damage and apoptosis. It influences pathways that control cell survival. It inhibits NF-kappa beta, TNF-alpha, interleukins 1b, interleukin 6, and interleukin 12, and it will attenuate chemokines, the monocyte chemoattractant protein 1, and the regulated upon activated normal T cell expression. In other words, it's good stuff. Saunas, we mentioned briefly. Heat from infrared sauna increases body core temperature. It is a deep detoxifying sweat at the cellular level, and sweating eliminates toxins. Heat-induced enhancement of circulation. We get heat from the infrared sauna, stimulates circulation, increases nutrient delivery, and aids in removing of toxins. Blue light sauna is more for skin issues. It acts as an anti-inflammatory. It can induce oxidative stress on microorganisms on the skin. So antifungal therapies, iatroconazole is a triazole antifungal agent. Its mechanism of action is it inhibits the fungal cytochrome P450 14 demethylase enzyme. It prevents the conversion of lanosterol to ergoesterol, an essential component of fungal cell membrane. Indications are treatment of fungal infections, antifungal prophylaxis in immune-compromised patients, off-label use for reducing mycotoxin effects in chronic exposure diseases. You can use this long-term. This is the one that Dr. Campbell is most agreeable to. Contraindications, you get a hypersensitivity to iatroconazole or any of its components. There is a slight risk of negative ionotropic effects, so anybody with heart failure, you need to be careful with this. And co-administration with any drugs that with cytochrome 3A4, we can prolong the QT interval. So quinine in any of those in that class. Side effects: nausea, vomiting, diarrhea, the usual. Serious side effects, again, congestive heart failure, liver detox. It monitors, you can need to monitor the liver function. It is potentially hepatotoxicity. Dr. Campbell claims over 14,000 patient treatments with little to no having to discontinue it. And I'm fairly new to this. I've had a couple of hundred patients. We've used iatroconazole and itraconazole, and I've never seen it. Usually start at 200 milligrams a day. If it's a particularly severe case, when we see the lab slip that or the test that you see, we can go to 400 milligrams. We'll do that for at least 4 weeks. And then we'll drop down to 100 milligrams if they're feeling better, and we'll treat them for up to 6 months. We'll treat them until they tell us that they're feeling better. And again, make sure that they're away from the mold. We watch their liver function and renal function, and we may decrease the dose from there. So these are the rest of these are again some more over the counter. These are specifically for mold and mycotoxins. So phylostatin is a Chinese herb. It's a combination of a number of herbs that you see listed here, and it has anti-GI infection. That's philodendron. There's some antifungal herbs, some for the gas and liver detoxification. It also has Codonopsis in it, and Disoceria and licorice root. Side effects include sleepiness, slowed breathing, blood sugar and cholesterol lowering due to a berberine component, and they can lower potassium. The dose that they come in a unit dose. You start 3 times a day and increase it to 3 times a day within 2 weeks. Make sure you take it between meals. Other antifungals, and I just went through these real quick. Nigella sativa, black currant seed oil. is active component disrupts the structure and function of fungal cells. We're using this. We found that this is actually quite helpful with Hashimoto's thyroiditis to decrease thyroid antibodies. And remember, there's a component of that here with the mycotoxins. Caprylic acid is a medium chain fatty acid found in coconut and palm oil. It dissolves cell membranes of candida and other fungi. Tea tree oil has an antifungal component to it. Garlic, we can do a whole lecture on garlic. Allicin is the active component in garlic that interferes with fungal metabolism. Coconut oil is a medium chain fatty acid that disrupts lipid membranes, and lauric acid, remember, is an antiviral agent, also called cell lysis and death. Oil of oregano has components in it that disrupt the integrity of the fungal cell membrane. Pau d'arco, which is good for urinary infections and urinary tract issues, have active components interfere with DNA synthesis. And lately, I've been studying for. I'm one step away from becoming a homeopathic MD in Nevada, and we can talk about that if anybody's interested in that. You don't have to live in Nevada. It gives us a layer of protection because the homeopathic MD. I shouldn't. Well, the homeopathic MD board has jurisdiction over all integrative medicine practices at least in Nevada. So sulfur and graphite are homeopathic remedies that we use specifically with skin issues that deal with the fungal components. So there you have it. So a brief overview. There's references here. If anybody wants them, I have 80 some references. And what happened here? Where do we go? And that's that. So we've got almost everybody left. So any questions?
Your presentation was great. I just want to add something here as usual. Now, Metlan Blue, I think it's the most powerful antifungal drug out there, not because I like it, but because in India, when they have this black mold during COVID, they use Metlan Blue versus itraconizoles and all those big pharma. And I think Metlan Blue is the best thing you use for treating even the fish tank from fungus infections and parasites. And nothing powerful alternative for Metlan Blue for that. So something that you may consider it as a beginning instead of going to antifungal drugs, which may have some side effects and toxicity to the liver, you start with Metlan Blue. Now, one of the problem with mycotoxin is a fat-soluble toxins. And like any other fat-soluble toxins, it's very difficult to get rid from them. And it's hard to find a good binder. There's the only binder that's big pharma they have, which is called cholestyramine. And the mechanism of action, the bile acid itself binds with mycotoxins, and then it gets into the gut. And then cholestyramine will make a complex with the bile and the mycotoxin and get rid from it. So that may be considered adding it to your regimen of detoxing fat-soluble toxin, because a lot of people, where are the binders for the fat-soluble toxins? Up to now, cholestyramine or any alternative to cholestyramine naturally that it combines with the bile acids and it gets rid from the fat-soluble toxins, including organophosphorus and the petrochemicals, and because they are fat-soluble and they concentrate in the bile, and you can get rid from them just by using this binder. So those two things I want to add it to what great lecture that you have. I mean, it's phenomenal. I mean, you cover everything. I'm just adding my 2 cents there. I don't know.
Yeah.
So what do you think?
Well, the only thing I'm going to say about binders is Dr. Campbell is decidedly against them also. So, and I know there's another side to it. There's Dr. Shoemaker. He's sort of the other side of it, and he's a big binder guy. So, if you ever listen to Dr. Campbell, he's pretty persuasive. If you're right, Stefan, I see you smiling there.
Yeah, he hates them, and I told the patient about Dr. Campbell's protocol, but he went and got cholestyramine anyway. He swears it's the only thing that helped his mycotoxins, and he had it bad.
So,
Well, this is publication. It has nothing to do with me or
right. Oh, I know. I know, but so
it's facts, you know.
I just
He's very strongly support the antifungal drugs, which I'm not against it, but I will not start it in the beginning if I have something powerful, an alternative. I mean, if you have a fish tank full of fungus, right? You're not gonna put atraconazole to treat it. You're gonna put methylene blue, and you can see the whole water change from a turbid color into a clear just by giving methylene blue. This is how much it's binding and detoxing and removing and degrading whatever it's causing this discoloration, which is I think fungus most of the time. So methylene blue, cholestyramine, and if there's any alternative that you find naturally that will be working like cholestyramine supplement, that would be good. If anybody here will dig into, maybe they will find supplement they work like cholestyramine, where they can bind the fat. That will be something good. And probiotic, piriform, Bactrim, Bacilla, Bacteromoldus, Bacilla, and those probiotics also helps in getting rid from the fungus. But other than that, your presentation was phenomena, great, comprehensive, and include everything. So thank you for
well, almost everything.
this.
So someone asked about ozone. Yeah, we've used that also. So hydrogen peroxide. I don't have any experience with that, but some of you might, and I've heard that's been used also. And toenail fungus. Well, there's lasers. There are some like lacquers that you can get. That ask me when we turn the video off, and I'll give you the brand name on that one. The trade name is the trade name I got in my head. The generic I don't. So maybe somebody else can think about it. Somebody asked about how do you know if it's methylated B vitamins? So, and Jane put it in here. So you need methyl tetrahydrofolate, and that's your methylated B vitamin. Most every supplement company, at least the more reputable ones, will make a methylated B vitamin. And we found that the methylated B vitamins get right into the cells. They get to where you need to be, and as opposed to just a regular B vitamin, you need about 7 or 8 B complexes to be equivalent of one of the methylated B vitamins. So that's sort of it's sort of our go-to there. We're also toenail fungus, iodoral. Is that oral, Stefan?
Yes, iodine oral.
Okay.
Very good antifungal, especially for toenail fungus.
Okay, and then so Dr. McLeod says a liposomal glutathione. Well, I agree. So remember, N-acetylcysteine is the precursors of glutathione, and a lot of the glutathiones out there, in the world are not liposomal, and if they take a glutathione orally, so one of the big companies sent me some glutathione in a pill form, but it's not liposomal. As soon as you swallow it, the stomach acid will just dissolve it. So make sure that, again, that it is liposomal. And yeah, I agree with that. So, okay. So that was my spontaneous talk on mold, pick up from Jane there. So anybody else have any comments or questions? John, you got anything for us this week? Still there?
Yeah, I'm still here. And a bunch of good stuff's happening. You remember our gentleman, Pete Dimitri, who was bragging on us last week? Anyway, it turns out to be a great guy, an unbelievable source. I meet with him next week, and we're just going to discuss a few
Don't
things.
mention a company name, okay? So
yeah, no company name.
Okay, I'll tell you what. Let's thank you, everybody. We'll turn our video off now, and